Karibu sana CEO.
Thank you very much, Samson, for the remark that you have made and welcoming all the partners to this function this morning at the Kenya National Commission on Human Rights. And I also join you to echo a big thank you to the European delegation for the continued support which has culminated into the report that we are launching here today. Now, before I make any remarks, I would like to take this opportunity to welcome Catherine, the Deputy Head of Delegation, EU, to make her remarks, after which then I'll come back to make the opening remarks, and then we shall straight away go to the findings of the study. And thereafter, again, we'll have a few speeches of the partners who have already been alerted. So, Catherine, take this opportunity kindly and make your remarks on behalf of the delegation. Karibuni.
I know. I don't know what it does to the electronics that we keep sort of spraying something all over it. All right, asante sana. Ladies and gentlemen, dear colleagues, dear friends, dear fighters for human rights, Dr. Bernard Mogesa, CEO, thank you for inviting us here today. Representative from the NCHR, representative from the National Council of Persons with Disabilities, Intersex Persons Society of Kenya, National Police Service. Dear media, thank you all for coming today. My name is Katrin Hageman. I'm the Deputy Ambassador, as was said, and currently the acting ambassador since my head of delegation left. So thank you for inviting us today. It's an honor to be here today, this morning, with you, to witness the launch of the second report of COVID and human rights in Kenya, prepared by the Kenya National Commission on Human Rights with the support of the European Union. Sorry, this mask thing isn't really working. Anyway, COVID, it's now been 1 year since the outbreak of COVID-19 in Kenya, a little bit more. And like many other countries around the world, Kenya put in place measures to curb the spread of the virus, including health measures, but also more restrictive temporary measures, such as social distancing, curfews, and travel restrictions. While justified and necessary to control the spread of the virus, restrictive measures can have a significant negative impact on human rights of individuals, including economic, social, and political rights. These risks were recognized from the onset of the pandemic, as we can recall the words from the WHO Director General on the 11th of March 2020, stating that all countries must strike a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights. As COVID-19 brought an unprecedented challenge to Kenya's population, the Kenyan government, KNCHR, and their development partners, including the EU and its member states, understood the significance of these risks. As a testimony to its strong partnership with Kenya, the EU has been swift in preparing a response in support of the challenges which Kenya faces today in addressing the COVID-19 global outbreak and eventually in moving into a post-COVID recovery phase. As Team Europe, the EU and member states committed to providing support with over 500 million euros in various sectors, from health response and social safety nets for vulnerable groups to macroeconomic resilience, SME supports, and trade facilitation, to name just a few. In particular, one of the first and immediate EU responses in Kenya was to support KNCHR to develop a specific project on monitoring and mitigating the impact of the pandemic on human rights, which is bringing us to where we are today. I must praise the excellent cooperation between our respective teams, which allowed this to happen in record time, and I thank you for your response on that. In the months that followed the outbreak, we have seen at times, and often for understandable personal reasons, the public being somewhat reluctant to comply with all directives here in Kenya, in my home country in Germany, and all over the world. We have also seen countries as duty bearers navigating this fine balance with more or less success. We have furthermore been concerned with the various reports throughout 2020 of serious human rights violations in the form of police brutality towards citizens who were or seemed to be breaking the curfew. But on an even larger scale, we have also observed in Kenya, and in fact everywhere around the globe, a significant negative impact of the COVID-19 pandemic on economic and social rights. Rights to health, rights to adequate housing, food security, water, sanitation and hygiene, labor and social security, access to justice, education, etc. These are not new effects, but rather a direct consequence of a sudden worsening of existing vulnerabilities and income disparities. Groups that have vulnerabilities are marginalized, such as groups and women and girls from poorer households, youth, elderly, children, persons with disabilities, detainees, refugees, LGBTI persons, all have been particularly hard hit. The most egregious examples include an increase of domestic sexual abuse of girls who are no longer safely attending school due to lockdowns, an increase in teenage pregnancy as teenagers loiter instead of attending school, an increase in domestic violence, both against women and children, additional pressures on women-led single-parent households, amongst many, many other violations. Kenya and the world are now making progress to find a sustainable exit to this pandemic. First, by mitigating its health consequences with an extensive vaccine rollout and its substantial macroeconomic consequences to our national economies, by designing and investing massively in economic recovery plans. In that context, we as policymakers and development partners have also a collective duty in putting particular attention to the long-lasting human rights effects of the pandemic on all citizens and communities, with a particular focus on the most vulnerable in our societies. We, as duty bearers, have also to pay particular attention to the necessity and proportionality of any restrictions of rights and ensure that the exception does not become the norm. In fact, one could argue that COVID-19 is a test of societies and governments, a test to our solidarity and resilience, but also a test of our respect and adhesion to universal values of human rights. The European Union recognizes that strong and effective national human rights institutions are a vital part of a country's human rights protection system. As Kenya's national human rights institution, with a clear mandate deriving from the Constitution, KNCHR has a particularly important role to play in that respect. First, in terms of monitoring, knowledge building, and awareness raising on the consequences of the pandemic. The report that you are launching today is a key milestone which deserves attention from all policymakers and development partners in this country. Second, in terms of state compliance with national, regional, and international instruments relating to human rights in its handling of the COVID-19 pandemic. Just last month, we have seen Kenya's commitment to the international human rights system acknowledged in concluding observations of the UN Human Rights Committee on Kenya's efforts to implement the International Covenant on Civil and Political Rights. Third, in terms of redress and accountability, to provide access, means, and appropriate mechanisms for citizens to seek appropriate redress when their rights are violated. Fourth, an NHRI must be well equipped and well capacitated to develop the institutional efficiency and ensure the independence required to promote and protect human rights effectively. These 4 areas are precisely the 4 objectives of the EU's current support to KNCHR. Ladies and gentlemen, dear CEO, as the EU, we believe that human rights are universal and indivisible, as described in the Universal Declaration of Human Rights. Whether one has COVID or not, whether one is a city dweller in Eastlea or a woman supporting her household in Wajir, or a citizen who wants to know more about his rights, human rights apply to all. As the EU is in the final steps of designing the priorities for its partnership with Kenya for the next 7 years, we see the importance of designing long-term responses to the long-term challenges posed by the COVID-19 pandemic. Everything that the EU will do in the upcoming years will be geared towards this. In this context, we focus on a human rights-based approach. Special consideration, in particular, will be made to the most vulnerable and most marginalized groups. Ladies and gentlemen, let me conclude by congratulating KNCHR today for realizing this important report at a crucial time. We're still in COVID-19. We still are seeing human rights abuses. It's good to have this report to flag where we have to focus next. We call on development partners to make use of these findings as a sound basis for appropriate human rights-based responses. I mentioned earlier that COVID-19 is a test for our societies and governments, both in solidarity and resilience. In fact, I would argue that COVID-19 has forced us to update our thinking and policies, and that it has created an opening for stronger collective action. Throughout its history, the EU has served as a champion of human rights. Now is the time to build a post-COVID world where the rights and freedoms of people are protected globally. In Kenya, the EU stands together with KNCHR and all human rights institutions, civil society organizations, human rights defenders, and activists who are dedicating themselves to upholding dignity and human rights of all, without discrimination of any kind. No one should be left behind, and no human rights ignored. Thank you to you all. Now we do some more spraying of...
Oh yes, it has become part of life. Thank you very much, Catherine, for your remarks. And indeed, amidst the COVID-19, no one should be left behind. Ladies and gentlemen, allow me to say that the Kenya National Commission on Human Rights is launching this report today which is a culmination of a rigorous research that was undertaken. And we are happy that the findings we are going to present today will inform various interventions by duty bearers. Ladies and gentlemen, since the announcement of the first COVID-19 case in Kenya in March 2020, the government has put in place a raft of measures in a bid to manage its spread. Almost at the same time, the Kenya National Commission on Human Rights embarked on a series of activities aimed at ensuring the promotion and the protection of human rights during this period. These activities that the Commission has undertaken include providing advisories to the relevant houses of Parliament, reviewing laws, policies and legislations relating to COVID-19, capacity building on promotion and protection of human rights during the COVID-19 period, processing of complaints and investigations of violations related to COVID-19, and redressing some of the violations through judicial process. The KNCHR developed a monitoring framework to guide all its operations related to COVID-19. The framework captured 9 thematic areas of concern to the Commission. These include health facilities and services, water and sanitation, housing, food, labor and social security, access to justice, media and access to information, detention facilities and other holding facilities, and vulnerable groups. Applying this monitoring framework, the Commission released its first monitoring situation report entitled Pain and Pandemic: Unmasking the State of Human Rights in Kenya in Containment of the COVID-19 Pandemic, covering the period of 15th March to 6th of June 2020. And we are glad a raft of the recommendations made in this report have found space in the government interventions and positively moving to addressing some of the gaps that the Commission identified in the first report. We have also kept engaging the duty bearers at the county level and the national government in implementing the recommendations therein in that first report. Ladies and gentlemen, between July 2020 and March 2021, the Commission embarked on its second situational report that shifted focus from the general population to a special interest group, namely the youth, the women, persons with disabilities, the elderly, intersex persons, and urban and rural poor. The Kenya National Commission on Human Rights commissioned INFOTRAK to support in this particular nationwide survey. And of course, the methodology applied a number of areas such as desktop research, qualitative and quantitative researches involving a sample of 2,430 interviews with members of the public. There were also 30 key informant interviews drawn from critical stakeholders and experts, and focused group discussions with 5 categories of vulnerable groups. The sample distribution of the survey was in 31 counties in the Republic of Kenya. The focus on the vulnerable persons is driven by the fact that as COVID-19 pandemic continues to be experienced in the country, its emerging socioeconomic and human rights impacts are evident, especially among the vulnerable groups. These groups are particularly vulnerable to the impacts of COVID-19 as they face isolation, misinformation, and lack of access to critical information, and are particularly vulnerable to torture and abuse by state actors. These groups also account for the highest rates of unemployment and underemployment, in addition to having limited access to social protection. Unemployment high costs of living, and access to health care are the key issues of concern among Kenyans. This was cited by 39% of the surveyed respondents. Other key issues affecting Kenyans include poor infrastructure, the outbreak of the COVID-19 pandemic, quality of education, and food security. Across all the groups, unemployment still stands out as the main issue of concern. However, the elderly are more concerned about the high cost of living. COVID-19 pandemic has extremely affected the activities of most Kenyans. This as noted by 65% of the surveyed respondents. Additionally, the top 3 areas that have been affected by COVID-19 pandemic, according to the surveyed respondents, are individual jobs, education, and access to food. Other areas mentioned include housing, healthcare, access to wash facilities, and access to justice. Ladies and gentlemen, at this point, then allow me to humbly invite Director Ann Oktoi, who is in charge of the Research, Advocacy, and Outreach Directorate here at the Commission, to briefly highlight the findings. And you'd also find these at our website, www.knchr.org. And thereafter, ladies and gentlemen, I'll share some of the recommendations which the Commission, after launching this report, will go on and work with the duty bearers in ensuring the implementation of the key recommendations. Director Ann, karibu.
Distinguished guests, it is my pleasure to share with you the findings of this survey that the Kenya National Commission on Human Rights carried out with a specific focus on 6 key thematic areas, and that is health, water, housing, food, labor, and education. And ladies and gentlemen, these are critical economic and social rights, and the Commission sought to find out how vulnerable groups have been able to enjoy these rights during the COVID-19 pandemic. And I'll start straight away with health. And the findings of our survey, and I'll focus on those who were treated for COVID-19 and mental health issues. Out of the respondents, 56% indicated that they were charged for the services they received for COVID-19 and mental health issues. 7 in 10 of those who were charged for these services, they felt that it was quite a lot, considering their vulnerabilities in society. And those who sought treatment for the COVID-19 and mental health issues rated the facilities they sought treatment as inaccessible. So when you look at the graphical representation, you'll find that 9 out of 10 of all the respondents in this survey have been to hospital to seek treatment for one ailment or the other. And out of this, you'll find that 64%, had sought medical services in public health services. So the majority of the vulnerable group actually go to public health facilities to seek treatment. And as I'd mentioned, those who sought treatment for COVID-19 and mental health issues, they rated these health facilities as inaccessible. And additionally, they indicated that the drugs that are in these public health facilities were actually inadequate. You all know that we are in the period where we are having curfew hours. And from this survey, the vulnerable groups indicated that they were actually able to access medical services after the curfew hours. And this is particularly with regards to the women. 85% of our respondents who are the women indicated that they were able to get medical treatment after the curfew hours. However, the elderly, stood at 45%, therefore indicating they're having difficulties accessing treatment after the curfew hours. So therefore, ladies and gentlemen, what is the state of the healthcare in Kenya during this COVID-19 pandemic? And in our report, we have highlighted the positives and the shortfalls in terms of the healthcare system in our country amidst the COVID-19 pandemic. I'll start with the positives. One is that we have had continued unperturbed access to essential health services. So this includes services around vaccinations, reproductive and maternal health care, as well as community-based care. Most of our respondents actually said they were able to access these essential health services amidst the COVID-19. Number two, our respondents agreed that the access to information around health services has been good, and especially critical information regarding the COVID-19 pandemic. Number three, most of our respondents agreed that the government measures to combat the virus have actually been effective and have slowed down the spread of the virus. Those are the positives. What about the shortfalls? What do we need as stakeholders to look into so that we can be able to improve the right to health care? Number one, there has been minimal to no waivers on fees and charges to the vulnerable groups in our health facilities, both public and private, during this COVID-19 pandemic. And this is cross-cutting to all the ailments, not just the COVID-19, but to all the ailments that the vulnerable groups face. Number two is the issue of the mental health, which remains an area that key stakeholders have cast a blind eye. And the vulnerable groups continue to bear the brunt. Three, the government measures for containing the COVID-19 pandemic have not taken into consideration the special needs of the vulnerable groups. And here I'm talking about groups like the intersex persons, persons with disabilities, among others. Number three, this survey has highlighted that there still remains high levels of stigmatization and discrimination, and the government has not undertaken adequate measures to address this issue. I will move to the second thematic area, that is around water, sanitation, and hygiene. You all know how critical this particular right is as we are battling this COVID-19 pandemic. And what the survey established is that access to water remains a problem. 78% of our respondents indicated they lacked access to clean, affordable, and constant water supply since the pandemic hit the country in March. Number two, more than 70% mentioned that they actually had to either have their water supply disconnected or spend more money in order to get this vital commodity. And if you look at the groups that were most affected, this is a graphical representation of the groups in terms of the access to right to water. You'll find that it's cross-cutting from all the groups, from the youths, the urban and the rural poor, the elderly, the women, persons living with disabilities. They were all greatly affected at more than 70% of each group. But however, the persons with disabilities were greatly affected at 88%. So that means our persons with disabilities are not getting this crucial right to water during this COVID-19 pandemic. I will go to the third parameter, and that is housing, and specifically mention that housing still remains a key issue of concern. 38% of our respondents indicated that they had been evicted from their residence at some point since March 2020. And when we asked the reason why they were evicted, almost all of them was because of the inability to pay rent. And very few had received any form of assistance from either the national and the county government to protect them from key issues like poor weather or even mitigating the risk of getting the COVID-19. And we all know that when you're evicted, you're more vulnerable to violent crimes, sexual and gender-based violence, harassment from the policemen, among others. So once again, 71% of our respondents, they mentioned that they were not aware of any measures by both national and county government to protect them from disaster. And 9 out of 10, which is more than 95%, mentioned that COVID-19 had affected their access to housing, and specifically that their landlords had not offered them a reduction in the amount of rent they paid. So that is just a graphical representation. Once again, when you look at the graph on the right, specifically a graphical representation of those who have faced eviction and some of the issues that they have faced upon eviction, including poor weather, contracting the COVID-19 pandemic, harassment from police, and violent criminals. Now, once again, how has the right to housing, or specifically evictions, affected the various groups that we were looking into? And you'll find that the persons with disabilities, once again, have faced the brunt in terms of eviction from their places of residence, closely followed by the urban and the rural poor. We also went ahead and had a discussion and interviewed the key stakeholders around housing to understand what the current status is with regards to the vulnerable groups. And our conclusion is, number one, the pandemic period has been flooded with numerous evictions. As a result, as I had mentioned, most of them rent defaults. Number two is that the most affected are the women and the children and other vulnerable groups, such as the persons with disability, intersex, that has led them to be homeless. Number three, when they are evicted, they encounter key risks, including diseases, crime, and increases their chances of contracting the COVID-19 pandemic. I'll look at the fourth thematic area, that is on food security and how the vulnerable groups were able to access this particular right during the pandemic. And our survey established that 67% of our respondents indicated that their households has not had adequate access to food. They have not had adequate supply of food during this pandemic. And most of them, when we probed further on where they were getting their food, most of them were buying their food, and very little were receiving support. Actually, around 1% only were receiving support, either from the national or the county government. So a lot of our vulnerable groups had to sustain themselves during this COVID-19 pandemic. And again, if you do a deeper analysis into which group was mostly affected with regards to adequate supply of food, you'll find that the intersex persons were mostly affected at 86%, followed closely by persons with disability, the urban and the rural, and the youth at 70%. So it's cross-cutting that most of these categories of the vulnerable groups have not had adequate supply of food during this pandemic. Again, if you look at what the current context is, therefore, it means that food security still remains a key issue. And the government has scarcely intervened to alleviate this very worrying situation during this pandemic. And we've established that non-governmental institutions have actually taken up the role to bridge the gap where they can. So there's still a lot that needs to be done with regards to right to food for vulnerable members of our society. I will go to the next parameter, which is on labor and social security. Now, what did our survey establish? One is that when we did an analysis of our vulnerable groups and tried to establish before the pandemic hit the country and after, and analyze what is the percentage of those who are employed and what the current situation is, you'll find that 80% indicated that they had been employed prior to March 2020. However, the current situation of these respondents is that only 34% are still employed. So you can imagine the numbers of vulnerable groups who lost their source of livelihoods during this COVID pandemic. And it has a ripple effect on their households in access to other rights. So there were also respondents who mentioned that they had or they have received a tax-free salary or a reduction of license fee and taxes for their businesses since March. You remember the government measures with regards to the reduction of taxes, but that lapsed this year. Then also to note is that 96% of our respondents highlighted that they have never received any form of cash transfer from the government. So again, employment status, as I'd mentioned, more than 80% across all the groups had employment before March, but then that substantially reduced to less than 30% of those who are still in employment. I will move to the fifth parameter, which is access to justice. And from our survey, we were able to establish that as a result of the virtual courts, most of the respondents actually said it was easier for them to access justice. And specifically, if you look at the groups, 100% of our women respondents said there was ease in access to the law courts. However, you'll find that when you look at the youth, they are saying 67% are saying they were not able to access services, and 60% of the urban and rural poor. And this you can attribute to the challenges that, for instance, people in the rural area would have in terms of accessing our virtual courts. So as a commission, we are saying that yes, technology has helped in terms of virtual court sessions and expanding the scope of those who can be able to access justice, but we need to put a keen effort on those who cannot be able to afford this technology. And as a commission, we're also noting that cases of crime have increased and that not every victim is able to access justice due to various issues, including there's the fear of bringing the perpetrators to justice. We have recorded cases of uncooperative state officers and prolonged court cases. So with the further focus on the virtualization of the courts, some of the issues that are affecting justice to the vulnerable in terms of virtual courts includes one, language barrier, the internal judiciary structures, but most importantly, the lack of the technology devices or access to internet so that you are able to access these court sessions. And of course, as a country, we still have various parts of the countries that do not have good internet. Many of our vulnerable groups do not have good technology facilities. And there's also the respondents, comments, lack of awareness on the whole process. I will move over to the last parameter, which was on education, and specifically noting that our schools, you remember there was disruption of the school calendar, where the schools were closed on March 15th, 2020. And the closure of the schools not only affected the learners and the teachers, but it also brought numerous economic and social issues. From our survey, this disruption resulted to interrupted and loss of learning. So whereas we had online schooling, especially for the urban children, the rural population and children from informal settlements were not able to participate in this online schooling. So therefore widening the gaps of inequalities in our society with regards to children's access to education. Then the disruption also caused homelessness, nutrition. You all know that during a school calendar, there are those vulnerable children that get government affirmative measures or help, including meals and sanitary towels that are provided in schools. So when schools were closed, therefore, this had a disruption on their particular rights. There was also we recorded a lot of childcare challenges and neglect, where the parents had to go to get a source of livelihood, and most of the children were left either alone, and this resulted to many, many, many issues, including teenage pregnancy cases we recorded are on a rise, and also just the whole sexual exploitation of our children due to the disruption of the academic calendar. So, ladies and gentlemen, therefore, when you look at how the vulnerable persons were affected by disruption of education, you'll find that as a result of the various social and economic challenges, most of the vulnerable families went back up country from the urban population. Most were laid off work. Most had to look for alternatives on how to survive. And it changed the social development of their children. So something that key stakeholders need to look at the impact on the children. And lastly, it changed the lifestyle of most of the vulnerable groups. So ladies and gentlemen, that is a synopsis of the findings of our survey in terms of how the rights of vulnerable population among us, with specificity of their social and economic rights, was upheld during the COVID-19 pandemic. So allow me to welcome our CEO to give us the conclusion and what the call of action from the Commission is to the various duty bearers. Thank you very much.
Thank you very much, Director Ann, for the summary that you have made regarding the findings of this study. And now we are moving towards a conclusion and the action kind of plan. You have informed us that indeed stigmatization and discrimination still remains a challenge, especially those that have been victims of the pandemic and their families. You have also noted that majority of the Kenyans' livelihoods have been affected, as witnessed in the cost of living going up, as well as inadequate access to health care. Judiciary, so that they can be able to reach all Kenyans and ensure there is access to justice. We have also witnessed, even from this report, that cases of violence are on the increase. Domestic violence has been witnessed across the country, and all these have been attributed again to the factors that Director Ann has mentioned, such as loss of jobs, inability to fend for families and provide those families with adequate resources such as food. And finally, the education sector, of course, has been affected. The learning calendar in our schools has been affected. However, as the schools have reopened actually this week, we hope that adequate measures will be taken to protect those children learning in our various institutions. Now, we make the following recommendations and call to action. On unemployment, there is need for multi-stakeholder involvement by both the private and the public sector to address this particular area. There is need to address the burden of high cost of living in the country so that we can guarantee the citizens quality life. So this is an area that needs further conversation by private and the public sector, as well as development partners. On medical facilities and services, we do acknowledge the fact that there has been support from the national government to the counties because health is a devolved facility. However, again, there have been reported delays in the disbursement of the funds to the counties and especially to the health sector, and therefore affecting this. So the Commission is calling upon the county governments to work with the national government and ensure that the resources are dispersed within the time frames as required so that they can be able to provide healthcare services to the citizens. 3, we need to put in place systems that can combat stigma and stereotyping, especially following the effect of the COVID-19. And this may require continuous sensitization and even information and training to the citizens, healthcare workers, and all those involved in the chain of healthcare. Number 4, on water and sanitation, again, there is need to fill this gap, especially the service providers, the county governments, and the national governments to provide adequate facilities to ensure that there is water supply to all the populations. And we take exception, especially of the populations who live in the slums and in the informal settlements. These are the most affected, as we have seen. However, we acknowledge the efforts, especially made by the NIMES and the county government, for example, in Nairobi, but this needs to trickle down and reach all the populations, and therefore good measures need to be put in place. On number 5, access to food, again, there is need for the government and the national government and the county governments to enhance livelihoods, a sustainable approach, so that it can guarantee the right to food to all Kenyans. And indeed, implementing Article 43 of the Constitution of Kenya is one way to guarantee the right to food for the citizens. On access to justice again, and noting that a lot has been done in utilizing technology, one of the issues that has come, of course, to our attention regards, the support to the judiciary, the funding for them to be able to provide all those services across the Republic. So we appeal to development partners and the national government to provide adequate resources to the judiciary to be able to enhance the provision of justice to the citizens. On the education sector, we call upon the heads of institutions, the Minister of Education, to put in place measures to protect all the learners in our schools, and particularly with a focus to the learners in the informal settlements and in the rural areas, and especially those children who come from the disadvantaged families and cannot be able to afford some of the basics like the face masks, among others. And finally, the Commission calls upon the county and national governments to create awareness on the available measures being taken to protect the vulnerable and their loved ones from disasters and pandemics. In cases where such measures are not available, there is need for prompt intervention by the 2 levels of government to be put in place so that they can ease the burden of the Kenyans in areas of right to food, shelter, education, and security, among others. Ladies and gentlemen, the Commission will continue with its monitoring work, and in this regard, it reiterates that the fight against COVID-19 will not be won without collective efforts by the state and the citizens at large. Kenya National Commission on Human Rights lauds the media for its continued efforts for sharing critical information with the masses. The Commission further invites members of the public and other stakeholders to continue engaging the Commission and other relevant duty bearers in ensuring that the right to health, among other rights in Kenya, can be accessed by all Kenyans as a right and not as a charity. Thank you very much. Now, Samson, the next program.
Thank you, Dr.
We are nearly done.
Yeah, we are almost done.
You're almost done. Okay, thank you so much.
So thank you very much, Daktari, and thank you everyone. I think that gives us a true picture of the status of our vulnerable populations during this period of COVID. I think our rallying call is to ask the duty bearers who are responsible to take note of this and ensure that the required action is taken. I think at this juncture, I would want to invite some of the few stakeholders that we have around that in one way or the other are directly attached with the contents of this report to make some few comments. And I'm going to begin with Clarice Oganga from the office of KNCHR. Karibu sana, Clarice.
Thank you very much. The CEO, Kenya National Commission on Human Rights, the EU delegation, NANRI, and all other guests. Good morning. I think on behalf of the Office of the High Commissioner for Human Rights, we are very happy to be part of this process. We were here last year when the Commission was launching the project. We were here when they launched its first report, and we are happy to be here when they continue to continuously inform us of how COVID-19 has impacted on the communities in Kenya and what Kenyans need to do to mitigate some of the impacts. So once again, just congratulations to the Commission for continuously highlighting, and being the constant reminder of the impacts of COVID. And while we appreciate that the government of Kenya keeps on giving us numbers, keeps on giving us data on the numbers that are affected daily, we are glad that the Commission is able to demystify the numbers and is able to break down and give us what those numbers mean to the communities in Kenya and what those communities have, how they have been affected and impacted by either COVID-19 itself or by the measures that the government has put in place. So I think I'll just speak briefly just to mention that I think this report then is a constant reminder to us that COVID-19 is here with us and will be with us for some time, and that we need to continuously remind ourselves that programming, budgeting must now factor the impact of COVID-19. If we fail to plan with COVID-19 in mind, then we are planning to fail, especially to fail our most vulnerable and marginalized communities. And so I think on behalf of the Office of the High Commissioner for Human Rights, we look forward to reading the whole report, and we look forward to further partnering with the stakeholders here and looking at the recommendations and the conclusions that have come from the report and seeing how to support, the communities and our national partners to implement the recommendations that have been given in the report. So once again, congratulations to the Commission, and we look forward to reading the whole report. Thank you.
Thank you so much, Clarice. I think at this point I want to invite Gilbert Sebihogo from NANRI so that he can make just a few comments.
Thank you, Samson. Mine will be just to, of course, introduce ourselves because some of our stakeholders do not know NANRI. NANRI, which is the Network of African National Human Rights Institutions. It's actually an umbrella body that brings together national institutions across the continent, including, of course, the Kenya National Commission on Human Rights. Of course, we are a continental body, but hosted by our member National Commission for Human Rights of Kenya. So we are grateful for hosting us, of course. And I would like also to, before even I congratulate the Commission, to appreciate the role the European Union has played and continue to play in supporting national institutions, not only in Kenya or in Africa, but globally, through the project we do have, which we call KNCHR's EU project. Now we are moving to the phase 3, and I thank you very much for supporting the Commission to keep it relevant despite these difficult times of the pandemic. Our supporters also, our traditional partner, the Office for the High Commissioner for Human Rights, to always be together with the Commission. Thank you for the support. I'd like to congratulate the Commission, which has been keeping itself relevant despite this difficult time. Of course, I know that across the continent, the challenges are there, but you continue to promote and protect human rights of Kenyans. Of course, we know that the pandemic has affected not only the citizens, but also it affects also yourself, because when human rights is not classified as essential services, you understand how you also suffer. But continue to do the good work, support Kenyans, protect their rights, and of course I know that this report, it's actually a very good tool that even other institutions in Africa will use to also build on their own mandate and also conduct such, similar assessments and evaluations. Of course, you are doing great work as Secretariat. Congratulate the CEO and the team, but you could do better if you could have commissioners in place. And this commission is actually going through, I can say, challenges because of lack of commissioners. And this is actually more than 1 year without commissioners. And I would urge the stakeholders, the friends of the commission, to really advocate, to be with us in advocating for the appointment of commissioners. I know this commission is doing good work, but it could do better with commissioners. This is actually a challenge across the continent, which we can also, we cannot actually wait to say that it's a kind of attack to institutions. Those attacks are coming in different forms. It could be the delay in appointing commissioners. It could be to cut the funding just to make sure that these institutions are not relevant. But I thank you and congratulate you because you are keeping your relevance to the citizens of Kenya. And we hope that with the support of our partners, we will convince the government to make the appointment of commissioners as a priority. So once again, congratulate you for the good work done, and you look forward to reading the report and also sharing it with other institutions on the continent. Thank you very much, and thank you.
Thank you so much, Gilbert. We are in the last end. There are two groups that have been adversely mentioned in the report. One, persons living with disabilities, and number two are the intersex persons. So I would want to take this opportunity to invite our friend from the National Council of Persons with Disabilities to say a word or two, and then we'll have it lastly from Intersex Persons Society of Kenya, who will give the final remarks, and then we'll do a photo session. Our CEO and deputy head of delegation, they will launch their report, and then we end it from there. So Joshua, the floor is yours. Karibu.
Good afternoon, everyone. Yeah, my name is Joshua Mutisia. I'm from the National Council for Persons with Disabilities. Today I'm here to represent the Executive Director, Mr. Harun Maalim Hassan, who had committed to attend, but an urgent engagement came up in the morning. So he asked that I represent him. And as we all know, he's also very vocal in the disability rights movement. Thank you very much to all the stakeholders who have participated today, from the EU delegation to the Kenya National Commission for Human Rights, in publishing this report. This report is extremely timely. It's very good that you have also provided a keen focus to persons with disabilities. And it has shown that the status of the persons with disabilities in Kenya is very, very worrying. From the National Council, we know that the conditions for PWDs in Kenya has not been that good even before the pandemic. The pandemic has just exacerbated their condition, and we are constantly trying to do our very best to provide our services to PWDs in Kenya. Through the leadership of the Executive Director, for instance, we have been working towards providing legal support to persons with disabilities. And it's good to see that part of the pillars of the report was the access to justice. In early March, we did our first legal aid clinic with the support of our partners such as the Office of the Ombudsman. And we really invite even the Kenya National Commission for Human Rights to come on board to help us, because we wish to roll out this legal aid clinic to all the 47 counties, because PWDs do not get that legal aid representation, and the situation is even worse for PWDs who have intellectual disabilities. So we would really need that support so that we can be able to provide that service to PWDs. We have also been making a lot of efforts in trying to ensure that PWDs are given a priority during the COVID-19 vaccination drives. We have been making some few engagements with the Ministry of Health, and it's also good to see that the report is also showing that need as well, so that PWDs can be given that priority in the COVID-19 vaccination drives, because we acknowledge the difficulties they face in accessing health facilities. Some health facilities don't even have basic tools such as ramp for wheelchair users. PWDs, some of them are very financially challenged. They can't afford that matatu to the nearest health facility. So we are working very hard to ensure that that issue is addressed. The violations of human rights and the social and economic status of people, it almost goes hand in hand. The poorer, the more somebody bears the brunt. And as a council, we have constantly been trying to provide support, financial support, through our cash transfer to persons with severe disabilities. But the greatest challenge is that because the council relies a lot on the KNCHR, our resources are very minimal in the presence of a very huge demand. So even as the years go by, we are going to have this unmet need that keeps growing up when it comes to providing services such as assistive devices to enable movement, etc. So we invite partners to come on board so that we can be able to address some of these unmet needs, such as provision of financial assistance, educational assistance to students with disabilities, etc., etc. So thank you very much for that. We look forward to engaging more on the report and other areas such as research. We have seen that you have done a very nice research, and would really wish to tap into that expertise so that we can work together. Thank you very much.
Karanja, James, to say a word or two, and then after that we'll have our CEO and the deputy head of delegation now launch the report through the dummy. And immediately the launch is done, we'll have the report accessible on our website and our various platforms. Karibu Karanja.
Thank you so much. Good morning. Good afternoon, everyone. I am Miri Oidera, aka James Karanja. I'm an intersex person representing the intersex community. And for me, here is my second home, having that the commission has really worked to improve the lives of the intersex persons. And allow me to read a small write-up that I did for this event. It's gradually acknowledging that the commission understands the plights of the marginalized community in the country, and we hope that with time that social justice will be achieved on these communities. COVID-19 pandemic has and the face and sorry and face higher barriers in accessing services, appropriate legal documentations. These experiences has even been exacerbated by the pandemic. These disproportionate impacts on the COVID on the intersex community has been as a catalyst to increase discrimination, social inequalities, and reinforced barriers in accessing education, employment, healthcare, food, and shelter, aggravating the already existing vulnerabilities and the violence faced by the community. The current health and economic crisis highlight the fundamental need for universal healthcare, social flow, social protection, and access to social justice, decrease barriers of accessing human development, and creating and implementing public policies, laws, and programs that include and address the need of the intersex community population and guarantee they are not further left behind. Sustainable and resilient recovery from the COVID-19 pandemic requires a approach to development. These approaches should free of the existing measures adopted by the society and the state must comply with the principles of equality, non-discrimination, participation, empowerment, and accountability, always following human rights frameworks and the inclusion of the most marginalized in all stages of building back together to achieve the 2030 agenda. Thank you so much.
Thank you, Karanja. And, it's refreshing to hear you recognize the commission as a stakeholder. Our support and that we require their rights to be protected. So I think at this juncture, I would want to CEO and the head of delegation do the official launch. Photos. So we have good shots? Great. Thank you. Thank you. I think those are enough shots. Good. Thank you. So I think this brings us to the end of our function today. Allow me to thank everyone who made this possible. Our friends from the delegation, we remain greatly indebted to you. KNCHR, you're always here with us. National Council of Persons with Disabilities, Independent Policing Oversight Authority, intersex persons, and everyone, and our friends from the media. We look forward to engaging further moving forward. Asanteni sana. Thank you.